Okay, thank you, Stefan. So I think we go for a discussion at the end. And what I'll do now is I will focus more on how to write the manuscript, and so at the end maybe we will discuss how to get the manuscript accepted and how to overcome some of the major issues when you write a paper. Now, there are several problems that we should try to avoid when write a paper. And there are, I mean, this is extremely true when there's a lot of push in increasing the publications, and especially there are some countries where career progression is related to impact factor, and you can see that there are some sins that should always be avoided. Some are more important, some probably are less important, but still have to be taken into account. So data manipulation and falsification, of course, it's the most important issue that should be always avoided, and it's a very, I mean, it should always, I think it should be regarded as a criminal issue. And is on the top. I mean, it's if you have a list of sins, this is the top, and so with that you should go to hell. And so it's basically. Then there is the issue of duplicate manuscripts. This is something that is reducing over time, but you see a lot of manuscripts that tend to report the same data. So one thing that you should avoid is to use same data in different manuscripts, and because that it's a duplication. The other thing is plagiarism. I mean, it's easy today to, more than it was 25 years ago. I mean, 25 years ago when we had to type the single paper, the single pages of each manuscript, and send it to the editorial office was a little bit more difficult to do plagiarism than, but of course it was also more difficult to detect it. But today it's very easy to do plagiarism in terms of doing cut and paste from different journals. But also it is easier for the editors to spot it. Now there are several softwares. I mean, one is called Authenticate, where you can just put the text and as an editor, and you detect whether there is more than 20 or 30% of similarity with any other text that is available worldwide. So that is something that it has been implemented in by most of the journals. So, but plagiarism is something that should be avoided, like redundant publications. There are a lot of people that, I mean, if you go on PubMed and you search for some authors, then and look at the title of the papers, and then you look at their papers, then you may see that it's basically, you can see similar publications or similar reviews that basically reiterate always the same concept, and that is something that also should be avoided. Now, regarding the conflict of interest, I think I have a more open view. As far as a conflict is declared, I think it's not an issue. What is the main problem when you write a manuscript is not to disclose a conflict. I mean, it is okay if you write a manuscript with somebody that has been involved in the early phase of the drug development and is also part of that manuscript. I mean, that is perfectly fine. What is important is that you acknowledge that. Also, you acknowledge whether you have any form of support. Now, the issue of the form of support is different between Europe and other areas of the world, because in some countries, say across the Atlantic as well, it's sometimes you get funds that go into your university, and then you get paid according to the amount of fund that that go into your research funds. So then you may well see that you may not declare your conflict of interest, but while you're getting money from your hospital on the grant that you're receiving. So that probably is a conflict that should be declared, and that is important. Sorry, okay. The other point is with the animal use. I mean, I said yesterday that there is a limited value for some of the studies on animal use. On the other hand, I think that there's too much on animal protection. I mean, animal studies are important. They should be carried, and of course, they should be done according to the laws and according to the regulations. But I think that we are going from one extreme to the other, and now we are tending to be too strict on the use of animals on research, and probably this has to change. A big issue is the human use. I mean, human use, we've seen, I mean, I think it's, we're far away from the issue of drug-induced problems in the 60s. But we still have to be aware that there have been some companies, some mainly American companies, that have tested some drugs in Africa, inducing a significant amount of death in children without reporting anything. So this is something that is extremely important and relevant, and so this is the type of human use that shouldn't be ever present in a manuscript, as well as any human use that any study in human that has not received a consent. So I think that we have a graduation of on the severity of these sins, but of course data manipulation and human use are at the top. The others have a different importance, of course, according to the level. I mean, you may say that conflict of interest may not be relevant, but we were discussing with Stefan some months ago about what we regard as significant, while for me, from a regulator point of view, even, say, 100 euros can be significant in terms of getting a grant from a sponsor. From other colleagues, 100,000 may be completely acceptable. So you see that the perception can be different. We always have to be aware that fraud is something that occurs in medicine. What is important is that then you have a senior author that then is able to declare that fraud and is able to tackle the issue. And this was a big problem that came with the Darcy case in Harvard, that basically involved studies funded by the NIH some years ago. But several other reports like this have been reported in the recent years. And you may probably be aware of use of some drug therapy in post-operative surgery. Now, the other thing is the use of statistics and data manipulation. I mean, it's important to understand, when you write a paper, how to use statistics to make the most of your data, but also how to use statistics not to manipulate your results. It's a thin line. I mean, but it is important to know that there is a line, and you have only to use the statistics to make the most and to do the analysis that is more appropriate to show the benefit, but according to that protocol. You don't have to use statistics to hide data, to make non-significant something that is significant, or to make or to change the type of analysis just to make, say, add to a Bonferroni test to a t-test, when just to have a greater chance to have a significant p-value. Now, I said about redundant publication. So what is a redundant publication? Of course, if you publish an abstract, that is not a redundant publication. If you have data in different journals, same data in different journals, that is a redundant publication, should be always avoided. If it's on a website, maybe can be a double publication. That depends on the amount of data you give and you have put on that website, whether that was in the form of a scientific paper or was reported. And then is it okay to include data into a review article? I think it is okay, but you always have to ask permission and to always have acknowledge the source where you published your data have been previously published. And of course, the expansion of a published data set is a sort of a redundant publication. In that case, what you should do is you shouldn't publish the full paper, but just an update on what you have done. Now, before starting to write a paper, then you have to think, what makes a good research paper? We have heard from Stefan. First, it must be good in terms of science and innovative. Now, innovative, when you think of what is an innovative drug, it's either a new design, it's a drug that targets a new indication, it's a drug that maybe targets a population where there's not an alternative treatment, or where there's a lack of treatment in that area. This is all very innovative. Or is a paper that tackles a very important physiological question that then they may lead to an advancement of science. So I was saying yesterday that in the past we were used to see a phone book of thick of abstracts at the AHA meetings in the past years, and the outcome that came out from that was very little. So we have to always ask ourselves, what is the meaning of that research, and if that will make an impact. Then data that you have that must be solid. They should be written adequately, and you should guarantee a good dissemination of what you write. So what is a good research? As I said, an innovative therapy in terms of therapy. So a new mechanism, a new unmet medical need, or any significant new medical benefit. The other big issue is, what is a good journal? And you may wonder, you may rank your journals according to the impact factor. I don't think that matters. If you look at a very high impact factor for New England, by New England Journal of Medicine, but it's also the journal that has the highest retraction because of retraction rate and on the solidity of data. So I think that what is important, a good journal is the journal that's more appropriate for the science that you're publishing. I mean, if you're publishing something on heart failure, it will be more relevant to publish into a cardiological journal or in a, say, internal medicine journal, rather than, say, in a very specific pharmacology journal. I mean, if this is very relevant. If, on the other hand, that is the initial research on the pharmacology that can lead to the advancement into heart failure, then it will be more relevant to publish into a pharmacology journal rather than go for a larger journal where probably the audience is diluted. So it's very much important to think what your audience is and how do you want to have that disseminated. And what is important is sometimes you get papers that are extremely long. So it's, the shorter the paper, the more concise the message, the clearer it is. Sometimes the more you write, it means that the more you have to hide, or the more you want to make things confused, and through argumentation. So it's, I think it's a nice paper is a paper that goes straight to the points with discussions on those points, and that's it. There are guidelines on authorships. So it's, and this is important that authors are only those who participate in collection of, in the collection of data, in the ideation, in ideating the study, in analyzing the data, and in writing the manuscript. And before starting to write the paper, what is important is that you need to know the focus that you want to give to your paper. So I think it's, if you spend time in preparation, then that is time that is saved later. So this is extremely important. So get your data all together, organize the results according to a logical structure, then choose the data to put in figures, then limit the number of figures, but put initially, say, prepare 6 or 8 figures, then go down to the number of figures as you write the paper, and then discuss with your colleagues what is the meaning of those results. So don't focus on your main results, because sometimes you may be attracted just by one finding, and that may be very relevant for you in that moment, because it's, you think that that is important, but then when you show it to your colleagues, then probably is less important, and there are other aspects that will come up. So what I always suggest to my researchers who are working with me is to write a good protocol. So if you write your protocol as if you were writing a paper, you have your introduction and material and methods ready for when you have to write the paper. So then you just have to add results and discussion. So this is very important. You have to spend time in writing and learn how to write a protocol. And when you write the protocol, think of writing the introduction, like if you were writing the introduction of your paper. The same for your material and methods. Try to structure them in a way that then when you delete 70% of it, you're still left with a good structure that is good for your manuscript. The title is important. It's simple and it's straight to the point, avoiding some phrases like investigation, study, novel, and acronyms. And then, of course, all of you know how the structure of the manuscript is, with the abstract, introduction, material, methods, results, discussion, and conclusion. But what is important is that the abstract should be short, maximum 300 words, 1 sentence, 2 sentences on the problem is investigated, 1 on the purpose of the research, then brief methods, adequate number of results, and then short conclusion. The introduction, sometimes you see introductions are 2 A4 pages, 3 A4 pages. I mean, that is not a good introduction. Usually you should have no more than 500 words for an introduction. 2 or 3 sentences, 2 or 3 paragraphs, just to summarize the important research, previous research. Then what was the background, and what is important is that what has led you to do the study, so your hypothesis for that, for conducting the study and the aim of the study. Then, of course, you structure material methods according to the structure of subject, sample size, description of methods, experimental and the randomization, data collection, and analysis. Usually, the problems that are made in when you write material methods, that either you put too little of information or too much of information for well-known tests. So if you're writing a study on exercise testing, it will be more important to give details on the intervention that you've done rather than write a long paragraph on how the exercise test was performed. saying maybe I've used a Bruce protocol with an increase of X in speed and X in inclination every 3 minutes. I mean, this is things that it's very well known, so you just give a brief one sentence on a very well known methods, but be more precise on whatever it's new in terms of your investigation. Be very clear on the flow of the procedures when you write your paper, and always put a little paragraph if possible if there are some sources of error that can be inherent to your study. The results should be objective, just a summary of data without any discussion. I mean, it's you can clearly see that there is a difference between when a paper is written by somebody say somebody who does medical and clinical research, or somebody who's been doing always basic research. Because in basic research, you tend to see a lot of people that, and also a lot of journals that tend to accept a mixture of results and discussion, and the results section is more elaborated, and it's compared to what happens for a clinical trial. But for clinical trial, you shouldn't be doing that. You should be more straight to the point. So the results just have to give your population what you found, your findings, and then avoid redundancy. If there's too much material, then try to add some tests to be reported into additional material to be added as a on the web, or additional material to be added to the manuscript. It's always better because the reviewers will be able to see that that material and analyze that material. But then the editors will be more prone to publish a short manuscript because it will take less space into the journal. So this is important. And then try to choose those 1 or 2 figures that go straight to the point and illustrate better the results of your research. So that is important. Regarding the discussion, what is important is that sometimes you see discussions that are very long, and you get a discussion of the main results after 2 or 3 paragraphs. You always have to start with 1 or 2 sentences saying the main findings of this study are 1, 2, 3, and then discuss the first one, the second one, the third one. So very specific, and then interpret the results just by saying, did the study confirm the hypothesis? Did the study provided an alternative hypothesis to what was known? What interpretation can be made? Are the results in agreement with previous research, or are they in disagreement? And in that case, try to bring a justification for that disagreement or an hypothesis for that disagreement. And we were discussing previously on the studies that they always look too good. So it is difficult to have studies that look too good. Often you have outliers, patients that behave differently, and this always happens. So it's what is important is that it is important to discuss them as possible sources of error, but also to discuss the possibility of say abnormal behavior of some patients, and it's important to discuss them. And always relate your paper to previous research. Then mistakes that are made during the discussions are those of mixing it with results, discuss with results that are not being presented, and make broad statements that are not substantiated by data, not discussing conclusive results, and if you cite ambiguous sources. So always, whenever give a citation, always put a reference to that. When you get to the conclusion, just write a simple, clear and clean conclusion. What is important is that your conclusion in your paper has to be different from the conclusion of the abstract. You often see that the conclusion of your paper is often very similar to that of the abstract. This is something that doesn't look nice. I mean, it has to be a little bit more argumentative. What is important is that you always have to acknowledge your support and your inspiration. You know, this was the Nobel Prize of Watson and Crick. And what they did, they said publicly when they received the Nobel Prize, I mean, we are very much grateful. We have been stimulated by the unpublished experimental research of Dr. Franklin. That lady had done very important experiments on the DNA sequence at that time. Has never published those. They had discussed that, and they've been so honest of acknowledging that at the Nobel Prize ceremony. So you see, that is something that always should be acknowledged. I mean, it's always important, and it's better to acknowledge and to give credit rather than avoid to acknowledge support or even the inspiration, especially for your mentors. Now, this is a pain. I mean, it's always a pain to have good references, and it's always. I mean, and you cannot quite understand why different journals choose to have different reference styles. I mean, this is something that should be solved sooner or later. But I mean, we have to live with it. So fortunately, we have some softwares that we know. EndNotes, RefWorks, RefMan, so now it's easy. You should use those, and they produce your references. And what is important is that now you have to use the DOI at the end of your references, because that is important in terms to have a complete reference cross-check. And so it is important to have it appropriate to the format, because otherwise sometimes you get back and I get asked of reviewing it. So this is something that it's worth checking, and at least once. What I do usually when I finish to write a paper, I never send it straight away. I leave it for a week or two. And I do this for papers, but I do also for protocols, unless I finish it at the very last minute before, I mean, 30 seconds before I have to click and for the deadline, but sometimes often happens. But if I have time, I leave it for, say, a week or two. And then you see that if you come back after a week or two, you see, you look at the paper with different eyes, and you spot a lot of inconsistencies and a lot of problems that you didn't spot when you have written after 1 or 2 or 3 days working intensively on that. And maybe get some feedbacks from colleagues, and if you can give it to somebody who's not familiar with the work, it's even better. I mean, to another colleague. I mean, I worked a lot with the endocrinologists in the past, and I got from them a lot of suggestions, and more suggestions maybe from them than from my own colleagues, and on criticisms on what my findings are. Then, when you get a revision, sometimes we get very upset when we get a paper that it's not accepted or rejected. But I think we have to read the comments, then wait, and then read them again after we calm down. And I think that if a reviewer misunderstands a point, then probably the points need a revision. Probably it's not clearly presented. Probably it needs to be better specified. I mean, because if he didn't get it, it's not his fault. Probably it's usually truth is in the middle. So it's not always his fault. It's not always your fault. One thing that is important is that you have to be polite in replying, but never submissive. That is very important. I mean, you have to be very firm. I mean, if you're convinced by of your results, never be submissive because it doesn't pay on the long run. And include a point-by-point explanation of the changes made in text in response to your reviewer comments. Then what to do if a paper is rejected? I mean, it happens. It happened to all of us. So think whether the journal was appropriate. And sometimes it's you just sent it to the journal that was out of focus. Make it more sexy. So it's probably the title was not so nice. I mean, it's make it. I mean, that is important. It's important for the editors. It's important for the reviewers. I mean, if you get, as a reviewer, if you get a paper that has say a title that is not appealing, it's and then it's difficult to read, then you tend to reject it. And I don't know, Basil and all the others, what do you think? I think we will spend less on that paper than on another paper that it gets your attention on with the title or with the presentation of results. Then revise the manuscript and resubmit. The other possibility is that then sometimes you have to accept the fact that the data are just not enough. And then you should use those data as preliminary findings for a grant application. And so that probably is the best use of your data. Then we know that there's this is a continuous process that goes through acceptance, rejection, preparation of manuscript, adding new data, and going back and forth with your editorial office. I have to say that, I mean, I was astonished. I had a paper that once I sent to the Lancet and was accepted in a week. Once I sent a paper to Jack, it took me 1.5 years to get it accepted. And now we are fighting with the European Heart Journal since September because of a figure. So you see, there is a high variability, and so you just have to be resilient, and you never have to give up. And you probably recognize it. Okay. So thank you. We will take questions if you have, and we'll discuss it.